importance. And we didn't actually get to do a whole session on bras. I would love to bras, but we told them about the importance of bras. Lots of the girls don't wear sports bras to do sport. This bra has been designed like with the developing breast in mind. So, and they designed the school uniform shops, and they sell through the company school uniform. Anyway, it's really adjustable. It's really soft. It's got breast pads in, so if they've got, like they're talking about the on-side boobs, that does that. It means you can take them out as the breasts grow. Like, it's really well considered, and it's really comfortable. So if they're wearing the bras for the first time, that's really good. Shout, limitless. But it's not, once they get to a C cup or above, it's not enough. And I think one of the other challenges with girls is when they get bigger, they're still wearing stretch crop top because it's comfortable, and they need to be wearing more. So we talked to the girls about their periods, their bras, and all the things that they were mortified about. But now, can sit back and listen to. And the last thing I wanted to share with you guys, particularly those of you working with girls in sport and physical activity, is what we know about injury risk in girls, and also about concussion. And the knowledge about concussion is ever changing, but we certainly haven't considered any kind of sex-specific aspect of concussion before, but now we know enough to probably do that. So injury is one of those things that we don't really associate perhaps with practical kids as well. They're quite resilient, aren't they? Bounce a lot. They're not getting ACLs every 5 minutes. But actually, the conditioning the habits we can get into the girls and the conditioning we can do now might really be impactful when they go to senior schools and start doing more competitive sports, because we know that girls are up to 8 times more likely to get an ACL injury after puberty. So as those hormones get in puberty, create changes within the body, whether that's anatomically, like our skeleton starts to develop into a sort of female-shaped skeleton, wide hips. That means the angle between our hips and our knees is greater. That means the angular stress that goes to our knee is greater. So those things happen. The hormones can affect our joint laxity. So the hormones of the menstrual cycle can affect how loose and stable our joints are. And overall, those changes after puberty can increase a girl's risk of ACL, non-contact ACL injury by up to 8 times. The average is about 4.5 times more likely. Yet, I've probably got some information. I did forget that picture. So I've already said one of the reasons we can't change this, by the way. So we're not going to be able to condition ourselves out of having wide hips. So that's fine. We leave that be. We leave be the menstrual cycle because it's happening every month, time and time again. And actually, we don't know what significance these hormones play on injury. We just know that they affect joint stability. And we can't change that, so that's fine. One thing we can change, or a number of things we can change, is muscle imbalance, muscle strength, agility, proprioception, coordination, landing mechanics, and those are all things we can implement when teaching girls to move. And particularly girls are quad dominant. They forget to activate their glutes and their hamstrings. They preferentially activate their quads, and that causes muscle imbalance. They land like this, and they can be taught to land properly. But if they land with a valgus knee, it's called knees caving inwards, they're much more at risk of injury. And the more we can sort of drum technique into them when they're little and they're doing, their little athletics, in the summer term, the more we can teach them about good landing mechanics, the less likely they are to be susceptible to injury later in their career. Because this might just be numbers, but actually we lose so many girls out of sports, particularly as they enter their early 20s and they've been really poorly conditioned throughout their teens. So by landing mechanics, I mean this kind of thing, like the way we land and the stability upon landing. And if we can keep coaching that in our girls, we can actually help them be more resilient, robust athletes when they go on to do sport later in their life. Football and netball have created their own programs to help address some of these risk factors. The football one's called FIFA 11+. The netball one is called Jump High, Land Strong. And if you're a member of England Netball, you can access those free. The FIFA football one is widely available. And those programs basically say if we spend 10 minutes 3 times a week working on the risk factors that are associated with being female in sport, and joint injury, we can reduce the risk so that now girls, men and women are at the same risk. So when we do something like the FIFA 11 Plus with a group of athletes, we can reduce overall injury rate by about 30% and ACL injury rate by about 45%. And that starts to bring the girls in line with the general risk for joint injury in sport with boys. So we can do something about it, yet we don't often see proactively sports within schools delivering some of this content. And that's because it's hard. It's hard to change how we've always approached warming our girls up, for example, because this goes in the warm-up. 10 minutes, part of the warm-up 3 times a week, you can cut injury rates by 50% in a group of girls. But one of the schools we worked on, we designed their own program. They looked at FIFA 11 Plus, they looked at the England Netball one, they said, right, we're going to do this with our girls, we're going to do some movement drills, we're going to do some agility, we're going to do some landing stuff, we're going to do some strengthening stuff, all in a warm-up. And the guy who was the head of PE, he was a former S&C coach, so he signed it all and he said, right, we're all going to do this 3 times a week. And everyone went, yeah, right. And went and just did whatever they did. Because it's really hard to change behaviour, and particularly around things like the warm-up, if you teach sport, you would have done the same warm-up with your kids, however exciting it is, but, the same. It's just we do it quite, traditionally. And so actually changing that is hard work, but it's really worth it. We've done some work recently with England football and the WSL, the women, and so many of them feel kind of sad about how poorly conditioned they've been across their years, and now they're young 20-year-old football players going, wow, I don't know how to move. And even though I'm strong and I'm brilliant in football, and I got to England, I still don't know how to move. And then you talk to their coaches and they're like, no, I have no idea how to move. So it's really easy to say, let's teach girls how to move properly. But we can actually target it in specific areas, like saying 3 times a week, we're just going to focus on making sure they do know how to move well. And like we said, there's a jump high, land strong for England netball, the FIFA 11 Plus. This has loads of different drills you can do with them. And then, I don't know if you guys get the publications called for, but the guy who we worked with over at Sherborne developed, published his little program so that teachers can just follow that. And it's just, for me, I'm not an S&C coach, but it's about awareness. It's about knowing that girls are more likely to get a non-contact ACL. That risk extends across all their joints. Ankle, shoulder, about twice as likely to get an injury. And it's a lot of the time it's stuff we can do something about within sport, particularly when we've got groups of just girls, because we can start working on them and be really explicit about it. But when we've got groups of boys and girls, these exercises don't hurt boys. They make them really good at moving too. Or you've done pelvic floor. I put that in. And we were just saying about pelvic floor, about how the girls, we did the year 7 and 8, didn't you? And they're like, oh, it feels weird. And we need to be having continuous conversations with these girls about the distance of their pelvic floor. And even if we're just talking about it when we're doing core work, we're using the word pelvic floor. We can ask boys to engage in pelvic floor as well, but particularly with the girls, because we don't talk about it enough. And then we have a group of athletes where the prevalence of pelvic floor dysfunction is really high. Up to 80% in some sports, the girls are leaking urine because they have pelvic floor dysfunction. And it's not the same with Vaseline that does in this talk, but it's not the same reason that women get leaking of urine when they have babies. It's because the girls don't know how to connect with, activate and relax their pelvic floor. And you don't have to be an expert physio to teach that. You just have to keep reminding them that it exists and that they can relax it and they can use it as part of their core. But again, it's something to think about. How can we subtly change what we're delivering to make sure that we address this area? I've talked to the girls today about not having periods and about the fact that that's not a great sign. We know that girls' injury risk is increased because of their energy balance. So girls who aren't eating enough to fuel their training and their school and their life are going to be more likely to be ill. They're more likely to be injured, musculoskeletally, but also very poor bone health. And we need to be probably on the lookout for that. I spoke to the Mill Hill nutritionist from the senior school, and she said, right, with the older girls, eating disorder prevalence is really high between 11 and 16. And none of us are qualified to deal with that. That's a clinical issue. But being really positive about food and just being really aware of your girls' behaviours around food, so you can go, I don't think that's right. And getting in early, be having conversations about food and about energy balance will mean that the health of that girl will be better in the long term. And then the other thing I wanted to throw out there was concussion. So obviously concussion is kind of in the press at the moment because in football and in rugby, we've got athletes who get to later in life and have significant mental health issues, and the relationship between having concussion and how they were treated for concussion in their sporting days has been made. And now people are like, oh my goodness, I don't think we're looking after our people in sport well enough around concussion to stop them having a long-term impact of that. And so that's brilliant. That's so good. What we haven't done is said, do we know that girls are actually suffering concussion differently than boys? And are we aware of that? And what are we going to do about it? I don't have any answers about what to do about it because we haven't got there yet. But what we do know from a big study of 80,000 athletes in the States is that girls are twice as likely to get concussion as boys. Probably because of our anatomy. So we have weaker necks and lighter heads. So when you're getting a concussion, what's happening is you've got that whiplash, your brain's moving around in your skull. If you've got a strong neck and a heavy head, that movement is going to be far less than if you've got a weak neck, a light head, and things like that. So they think that those sort of things increase the prevalence of concussion in girls. So, for example, the knock-on effect of that is being on rugby, they're doing neck strengthening. Now, it might be that the girls aren't doing such vigorous work that needs neck strengthening. That might come down the line. But also, in this big study, boys were taken off the field of play 1.5 times more often than girls when they suffer concussion. So we're not recognising concussion in our girls, and then we're not spotting it and taking them off the field of play. That might be connected to the fact that girls are getting more head-to-ground contact concussion. Might be linked to the fact that they don't know how to move, don't know how to fall over. But when you get a head-to-ground concussion, it's far sort of less obvious because it's just you and the ground that have that conversation. Whereas if you hit your head against someone else, you've got this slightly more obvious scenario. That might be one of the reasons why we misregard concussion. And then girls have worse symptoms of concussion and can get longer symptom prevalence. So we've got guidelines which say this is how we return an athlete to play when they're being concussed. And it's a 24-hour step-by-step protocol. So if someone is truly concussed, then you have to obviously take them out of the field of play and they start a recovery protocol and they start introducing kind of different intensities of exercise and then they wait 24 hours. Does that feel okay? Yes, okay, now you can take your next step in recovery, 24 hours. And what the research is suggesting is that we need to extend the recovery to girls. Now, we don't know what that looks like, but it's just an indication that recovery might take longer for girls and they might be showing symptoms for longer than boys. So that's kind of interesting. We don't really know what to do with it, but we do know to be vigilant in our girls with concussion. We do know that we probably think as schools probably need to be really diligent about understanding how we recognise concussion and then what we do to return kids back to sport after it, but also knowing that for girls, it might be presented differently and worse. So that's some information for you. It's hard to give any kind of prescription. Preventing joint injury in girls is about you deciding what fits into your programmes and being proactive about it in a way that suits you guys. But there's programmes out there that can help you design that. Concussion is about knowing that your girls are at risk, maybe at greater risk, and that we need to be really vigilant around head injury. And at the moment, that's kind of where we're at. But it's always useful to start to put that message out in school sport because we haven't had a very female-centric approach to these types of topics before. And this is just an aspect that is very kind of female-centric. So, thank you. Thank you, Pat. I'm running. I've been passing around in front of year 5 to year 7. So this is like the last guard. I hope that's.
I don't know if there are any candidates who have it. Yeah.
Yeah, so I created the app, Jess. Yeah, so I didn't have to build the app, that's pretty hard work. To be honest, cycle mapping as a concept is great. So getting girls to understand their cycle. So this is what we talked about in their sessions, to say there are some times in your cycle where you'll feel amazing and your hormones are actually on your side in terms of feeling like you have a recovery, feeling more motivated to move. And there are times in your cycle where you might not quite feel like that, and you might feel like you're sort of destined for slightly slower, lower intensity exercise. And actually tracking your cycle and understanding what that feels like for you is really good for girls, brilliant. We aren't at a place where we can prescribe training around that. Cycle mapping asks women to sort of lead into that part of their physiology, but for groups of girls, we're just not there yet. And even the teams, like, if you see a headline that says Chelsea are training around their cycle, I mean, they're not training around their cycle, they've got 30 girls. They're not going to be like, oh, geez, you're on day 7 or you're on day 14. What they have got is girls tracking their cycle and saying, maybe today I need to do a bit of a long warm up because that happens in this part of my cycle. And they're trying to get girls to understand their bodies better so they can show up to you as a coach and say, this is who I am today and this is what I need. So that's the concept behind that. And it's brilliant to get girls to do that because they kind of sail through and bump into things that are happening that, oh yeah, I do feel like that. And you're like, actually, if you know that happens every month, let's start working with that and preventing stuff that's stopping us doing our best.